Hi, it's Dr. Lamia Gabal, and I'm here today to talk to you a bit about your upcoming surgery, which is a trans urethral resection of the prostate. So trans urethral resection of the prostate, or affectionately known as a TURP or a roto-rooter, is when I'm going to be under anesthesia. I'm going to be going into the urethra with a scope, a larger scope, and I'm going to core out the middle of the donut hole, opening up the channel so that you can urinate easier. And the process is that about 2 weeks before, we want you to be seen by your primary care doctor, and that he or she will do some pre-op evaluations and EKG and some blood work to make sure that your heart and lungs are healthy enough to undergo anesthesia. We ask that you stop your supplements and most blood thinners about a week beforehand, although some supplements can be stopped 3 to 5 days before the procedure, some blood thinners, and that is what your primary care doctor and whoever is prescribing those blood thinners will go over with you. And then nothing to eat or drink after midnight the night before. You will go normally to the outpatient pavilion. In some cases, I will do this surgery in the main operating room of the hospital in order to keep you overnight, but most of these surgeries are done outpatient. So you'll present to the outpatient check-in about an hour and a half before the scheduled time. I will see you there before you go to sleep. The anesthesiologist will meet you there before you go to sleep. And then you will be completely asleep under general anesthesia. Your legs are up in stirrups. I go into the urethra with a larger scope, and with a loop, I'm shaving out the inside of the prostate. So we're still leaving the outside of that donut. The prostate is like a donut around the urethra. So we're leaving the outside intact. We're just cleaning out the inside to open up the channel so that you can get started urinating easier, empty completely, have a stronger stream. It also helps to prevent urinary tract infections if that's what you're suffering from. So the surgery itself can take anywhere from an hour to an hour and a half. You'll wake up in the recovery room with a pretty good sized catheter draining the bladder. And then we put some irrigation through that catheter for a few hours in order to prevent any blood clotting. You will go home with the catheter, but you'll expect to be in the recovery room for about half a day or so from the time you get there to the time that you're discharged. And then you'll go home with the catheter. And again, depending on what happens during the procedure, you will be instructed on how to remove the catheter, which is super easy. There's a little balloon that holds it in place so that it doesn't fall out on its own. And the nurses will show you how to deflate the balloon. And if you're standing up in the shower, once you deflate the balloon, it will literally fall out on its own. Very easy. You cannot cause any harm. And so usually you're instructed to do that about 2 to 3 days after the surgery. It really is dependent on exactly what happened during the procedure. So then once you take out the catheter, what you will expect to see is a very strong stream. I like to tell my patients you'll be peeing like a racehorse. You can write your name in the snow again because you have a very nice wide open channel. But it will burn a little bit, especially when you're urinating. You will still see blood in the urine for at least a few days. And your overactive bladder symptoms can take up to 6 to 8 weeks to get better to the point where they should either improve or resolve. And so we usually give you at least a few days worth of antibiotics. There's really very few pain meds that are needed for this procedure. If anything, over-the-counter azo or pyridium can be very helpful. It turns the urine orange. It helps to numb the inside of the bladder and the prostate for the burning with urination. And then we usually see you back at about 2 weeks, which is about when our patients feel back to normal. And we usually get you back to your normal activities by 2 weeks post-op. There's a few risks with this, as with any surgery. There's a small risk for bleeding. You should not require a blood transfusion, but you will see blood in the urine even up to a few weeks after the surgery. So need to drink plenty of water to help flush that out and prevent that from turning into blood clots, which could then plug you up and make it so that you can't urinate or so that the catheter doesn't drain. And there's a small risk for an infection, even though we're doing this in most cases to help prevent urinary tract infections. Because of the instrumentation and the type of procedure that it is, there's no guarantees that you won't have another UTI, and there's a small risk of another infection around the time of the surgery. And then, as with anything, there's no guarantees that this will 100% resolve your symptoms. But if I am recommending it for you, then most likely the benefits outweigh the small risks, and it would be a good procedure for you to undergo. So thank you.